Hi everybody, this is Summer, lactation consultant here with Done Naturally. And today I'm going to talk about an extremely important topic. We are going to talk about postpartum depression and postpartum anxiety, PPD and PPA. So this is a very tender topic and a topic that thankfully is being more and more talked about. When I was a new young mother, this was not talked about very much, and there was a lot of shame and a lot of muddling through. And now we're not seeing that as much. But I am still many times encountering families, mothers who are struggling and afraid to reach out, afraid to medicate, and worried about their baby. So here's what we're gonna do. I'm gonna give you some information and you are going to hopefully feel more equipped to get yourself some help. First of all, there is absolutely no shame and needing help whatsoever. We go through an enormous change when we are pregnant and then give birth and then have a child to care for 24/7, are breastfeeding or pumping, and all of those things I've just mentioned are hormones. And so we as women go through massive hormone changes through all of those times. And then every child that we have after the first can increase our load of work, our emotional load, our physical load, all of that. And if we are struggling and haven't received help, talk therapy, medication, yoga, exercise, time outside, all the things that I probably don't need to list, then it just compounds every time you have another kid, and it can get worse and worse. I suffer myself, and I muddled through in my early motherhood. I was not diagnosed. I should have been. I should have been receiving talk therapy. I should have been receiving medication. And I didn't know at the time that postpartum depression can be really more postpartum anxiety, which is what I was experiencing. 20 years ago, I wasn't familiar with the term postpartum anxiety. I was familiar with postpartum depression. I didn't feel sad. I remember going through that stuff thinking, well, I'm fine. I want to get up and I want to take a shower and I want to do things. And, I'm not crying all the time. And I don't feel depressed. So I thought that what I was feeling was normal and I should just deal with it. And, the more time that has passed, I look back and I see old videos of myself. And it's so clear that I was suffering from major anxiety, which to date didn't get diagnosed until I was 40. And I'm 45. And I had my first baby when I was 25, something like that. So that's 15 years of anxiety that was untreated. And I don't want any of you to ever go through that. It is horrible. I was obsessed with time, counting, naps, sleeping, not sleeping, eating, not eating, how much time we have until the next feed. Counseling you mothers, I've been there. and I know it so intimately. And it's very easy to recognize in someone else and extremely hard to recognize in yourself. But I do want you guys to get help, because it is not the way that you have to live your daily life, is struggling or feeling like, feeling consumed with anxiety, feeling consumed with this, if it's more of a depressive state. There are so many resources out there, and as a breastfeeding or pumping mother, it is so safe for you to use pharmaceuticals. I can't say that louder, highlighted. Like, it is so safe. No one should be trying to abstain from pharmaceuticals because of concern of the baby. It is so well documented. It is the family of medications that is the most studied. Anti-anxietals and antidepressants are the most studied. It is better for the mom and for the baby to be medicated and live happily as opposed to struggling and not medicated. It is safer for the baby for mother to medicate. We're talking about a host of anti-anxietals and antidepressants. I mean, I could sit here and name many of them, but I would say in a room of 20 women, like thinking about my support group that I lead, if I were to ask the question, which I have before, when we've had a mother who admits that she's struggling and concerned about what to do, I will ask for a raise of hands for how many women are feeling the same way and or are diagnosed or medicated. About 75% of the room raises their hand. So this is a very, very common thing for women, and it is okay to need help. It is okay to ask for help. It is okay to medicate. It does not put your baby at risk. It is so much worse for a mother to be suffering, and so much worse for the baby. Dr. Tom Hale, who is the author and researcher, scientist, and pharmacist that has written Medications in Mother's Milk, and is the owner, CEO of Infant Risk Center, which has a free phone number to call if you ever have a question about a medication, which the book Medications in Mother's Milk, every lactation consultant should own, and can look up every single drug on the market, and it comes out new every 2 years. And it talks about all of these medications and all of the studies and how safe it is for mother to take while breastfeeding and pumping. So please, I need you all to understand that it is not something that you should feel scared about taking, worried about the baby. It is incredibly important that you reach out, get a therapist, get a psychiatrist. A psychiatrist is going to manage medications for a breastfeeding or lactating, pumping mother much better than a general practitioner, much better than an OB. And any OB worth their salt will admit that. Mine did. And I wasn't even having a baby, and she said, I really want you to see this psychiatrist. She gave me a name, who has turned out to be amazing, and said she will manage you and the pharmaceuticals way better than I can. This is not my expertise. So getting with a psychiatrist is important. Not everybody responds to medications the same. One antidepressant may totally work for this mother and not at all work for this mother. So there is there in the beginning, there's kind of a trial and error process that the psychiatrist and the therapist monitor to see if it's working for you. Is the dosage right? Do we need a different medication? Do we need a coupled medication along with, do we need an antidepressant and an anti-anxietal? Certainly things that are not my expertise, but what I do know as a lactation consultant, as a mother, as a person who herself is diagnosed with general anxiety and is on an antidepressant and also an anti-anxietal and also a mood stabilizer. I know that the best thing for someone who is struggling with those things is getting help. And if medication is what helps, it is safe for her. It is documented to be safe for her and the baby. So we don't take this lightly. That's why it's the most studied family of medications, because it's so common. So this isn't just a flippant, oh yeah, it's probably safe. No, it is extremely safe. So I'm here to tell you that do it. Reach out for help. Don't struggle for 15 years like I did with massive anxiety. You need help. It is okay. Maybe you need help for a segment of your life. Maybe you need help for a long period of your life. Who knows? But feeling better and feeling healthy is very important to your family and for your baby. And you should not be afraid to medicate if that's what's necessary and your physician and your therapist have recommended that. On a side note, personally, I do not think that postpartum depression is managed well by placenta encapsulation. I think that is very, very dangerous, and dangerous because it doesn't work. And then we have a mother who is taking things and getting worse. Much safer for her to use something that we have so many studies on that works. And not to mention placenta encapsulation, if used particularly under the first 6 weeks, risks milk supply, which I have a video about that too. So this isn't something to mess with. This is something to take very seriously. Is there a stigma about women and illness and medications and all of that? Absolutely. But guess what? There's a stigma about everything. And we have to try to bust that stigma and help women who are suffering know that they're not alone, that there are many, many of us out there, and that it is possible to feel healthy and continue to breastfeed, continue to pump, and take care of your baby in that way. So anyway, much love to you for those of you that are feeling that way, because I'm there with you. And I hope this helps you feel like you can get some help. So that's all I have today. Give me a thumbs up if you like, subscribe, and I will see you guys later.